For many generations, Black women have been strong, powerful, resilient, and hopeful about the future.
I believe that self-care is one of the single most important things that you can do for yourself. I'm teaching my children not only to love themselves and to embrace themselves, but also to take time out to find the things that make them happy, make them love, and to make them feel free every single day.
Today and every day, the Black Women's Health Imperative celebrates our diversity, our beauty, our magic, our confidence, our joy, our love of life, our love for family, and our love for each other. May we all be Black and well for generations to come.
Good afternoon. Welcome to Black and Well TV. I'm Linda Goler-Blount, President and CEO of the Black Women's Health Imperative. For many women, pregnancy marks a time of special moments with family and friends, baby showers, gender reveals, and mom-to-be photo sessions to commemorate every month, every moment until the beautiful baby arrives. This will not be the story for most mothers who are pregnant during this COVID-19 pandemic. A recent report from the CDC suggests a higher level of risk for pregnant people than was previously thought. And while the recent data shed some light on the coronavirus and pregnancy, there are still many unknowns. Can pregnant women who have COVID-19 transmit the virus to their babies? What happens to moms-to-be who are diagnosed with the coronavirus early in pregnancy? Will the increased use of telemedicine have an impact on prenatal care? On top of these concerns, many of these moms are separated from their families. They cannot visit with them, and there are no in-person celebrations. Today, we have three women who will share their stories from working on the front lines of caring for expectant moms to expecting themselves without the physical support of family and friends and facing the unknown alone. Our first guest is mom-to-be Danijah, who will share her experience of being pregnant during a pandemic and how she handled a medical emergency while being separated from her family. Next, we'll speak with Jessika Jackson, creator of Hey Black Mom, an online information website dedicated to providing support and resources to Black moms and moms-to-be. And finally, Dr. Sharon Thompson of Central Phoenix Obstetrics and Gynecology will talk about what people who are expecting need to know to have a safe and healthy birth during this time, and how to prepare if you and or your baby are affected by the virus. So this is designed to be an interactive session. Please use the chat function to ask questions. We'll try to get to as many as we can, and if we can't, we'll get to them after the show. So for now, let's welcome our first guest, Danijah. How are you?
Hi, I'm great. How are you?
I'm doing okay, trying to hang in there.
Pretty much. I think we're all going through that part.
I think you're right. We wonder what the answer really is to that question,
We're all kind of like, yeah, we're just getting through that. Getting through it. Right. It's another day.
So congratulations on your pregnancy.
Thank you.
You are an entrepreneur. You have a growing business. Mm-hmm. You're pregnant. How is that in general right now?
So I think it's a mix of the entrepreneurship mixed with the pregnancy, mixed with COVID, mixed with the emotional part of pregnancy, the physical part, and it's a whirlwind of emotions. Sometimes it's like, oh, okay, it's not that big a deal. And then there's little moments where you're just like, oh, I kind of wish somebody was here to see this, or I kind of wish somebody was here to help me with this. And the closer you get to birth, it just gets more and more real that this really affects every part of my pregnancy, whether it be, somebody to hold your hand while you're giving birth, or come see the sonogram and, the whole family sonogram that they do with the 3D, like they don't do it anymore. And so that can sometimes be just like, is this experience really seen by, it's being overshadowed, and then you don't want to take away from everybody else going through things and celebrating things. But I think motherhood, like this one staple in my life, like I will always remember, well, when I was pregnant with you, everything was kind of shut down.
You're going to have a story or two to tell.
Yes, absolutely.
So, talk a little bit about your pregnancy journey. I mean, we are used to having the regular prenatal visits and conversations with your doctor, which you've had.
Yes.
But you had a bit of a complication.
Yes. So my pregnancy journey, it started with this. It was a complete surprise. And it was more so, at first, oh, okay, I'm pregnant. Great. Pregnant, running a business already, that's already something like, okay, we'll just make plans for that. Pregnant now, lockdown and alone. So what happened was, going to prenatal visits and the excitement of no mask and seeing sonograms, and went from that to walking in full gear. You walk in, you wash your hands, you sanitize, you have your full mask on. Everybody has a mask on, 2 people in the waiting room. And this one particular appointment I had, so excited, this was when I was finding the gender out. And I went, and sat there. I got the gender envelope. And I go to meet my doctor after the sonogram, and he's like, healthy baby, weak cervix. And it was just like, I don't need this right now, because what are we going to do? And he gave me options. He said, well, you need a cyclage, which is a procedure. And I'm like, well, where would this procedure be? And he's like, in the hospital. And at this point, this is prime COVID. This is like, even walking to, because the way the hospital is set up, like he's on this side of the street, and you don't even want to walk on that side of the street because you're just like freaking out. And at this point, it was either I stay on bed rest, because I was dilating at 20 weeks. So if you don't know, basically I have an incompetent cervix.
Yeah.
So I started dilating at 20 weeks, and he said, we can either put you on bed rest, strict bed rest for the rest of your pregnancy. Okay. Or we have surgery in the hospital, prime COVID.
Yeah.
And this is all said through a mask, me sitting with the mask. And it's just like this sigh of almost, what? Like, what? There's nobody really there to comfort me.
Right.
So my family's all in New York. So majority of my family, my mom, my grandma, my aunt, they're all in New York. So I remember just sitting there like, oh my God, what?
Right.
And
nobody even to turn to at that moment. Right.
Okay. And I waited 3 months to tell my family I was pregnant, just because I was just so, going through just so much at the time. And so finally I said, I'll be on bed rest. That was the initial decision. Mm-hmm. And I had some people I'll reach out to help me, but I didn't realize how much help I actually needed. I couldn't go to the bathroom. I had to crawl to the bathroom because I was so scared that at any moment something could happen. And my doctor did warn me and say this, I suggest the cyclage, but I was so worried. I said I didn't want to endanger my health with the COVID. What if I catch COVID in the midst of this? What's going to happen to me? And I'm an entrepreneur. I really can't even take the time off to deal with COVID right now. So, after 2 days, I fell into a small depression because you're sitting in bed all day. There's nobody here. Nobody can be here even if they want to be here. Usually there's somebody to visit, make you dinner, mm-hmm. support. I didn't have that. So it was me crawling to the kitchen, crawling to the bathroom, crawling back to bed, sleeping. Oh my God, what's that feeling? Okay, nothing. And I remember after day 3, I was like, I can't do this anymore. I called him and he got me into surgery, and it was showing up, taking the COVID test, which was surprisingly interesting. Waiting in the car, getting the results, and then going into surgery.
Okay.
And then just even after surgery, nobody can really be around you to help.
What was that setting like going into surgery?
My surgery was scheduled for 8:00. I didn't get until 1:00. because literally it was the first day of outpatient surgery. So I was one of the first few people that went in. Nobody was allowed in the building unless they had a COVID test. So you literally drove in, got your thing, waited in the car. They gave you a call, said, park your car. You can come in now.
Okay.
Then they checked your name. I'm sure you were negative. You sat, you wait. The nurse came and got me, took me up. We spoke a little bit, about it because it felt very tense a little bit because everybody's kind of just like, and everybody's geared up. It wasn't even, I thought maybe it'll be a little more lenient. No, it was everybody geared up. You're the only person not geared up. So I felt it was nerve wracking because I felt vulnerable even sitting there like, don't touch anything, don't look at anything. And saw my doctor, that put me at ease. Once I saw him in the operating room, it totally put me at ease. And then recovery, you just sit there until it's time to go and you leave.
But you had to have somebody
I did
drive you. So, but that person couldn't wait with you.
No, they're not allowed in the building at all. So usually when you have outpatient, they could wait with you to that moment where they take you. Even through, I think recovery, maybe they wait with you or they have somebody come. No, they had to literally call, hey, you can bring the car around. You can bring the car around. And they bring you out full gear, really come out. And it was hard because even when my close family friends, like my godmother, she wanted to come over and help, but it's that lingering fear of if I give this to you or if I'm somebody with no symptoms, there's nothing you really can do.
I think we lost you for a moment. So the question I have, you're going to go back to the hospital.
Yes.
Fairly soon.
Yeah, every appointment is going, you mask up, you go in there, but I do have to go back for the procedure to get the cerclage removed. And that's going by yourself again. And, usually, my doctor, explained, usually there would be somebody with you, but the nurses are amazing. I love my doctor. Then it's time to give birth and
you go back then. So are there any, well, let me just ask, what are the plans then? Has your OB explained sort of what that process is like and what you can expect when you go into labor?
Yes. So basically it's one person. This one person goes in, stays in, and doesn't leave.
Okay.
So it would have to be, somebody that can sit with me. My godmother's going to do that with me. And since my family's in New York and they can't come with me through the whole process, she'll come sit with me and just 24 hours, push her out, get out, pretty much.
Can she stay there the whole time with you?
Yeah. So I'll get a COVID test, and they're giving the mothers COVID tests before they go in.
Okay.
And she'll stay with me the whole time, and then that's pretty much it.
So you mentioned, just a little bit of stress. What have you done to sort of manage the stress and just sort of, as best you can, stay on an even keel through all of this?
The answer changes because literally this whole process changes. And I've learned with the whole, like some things that worked last week don't calm me down this week because there's a new, she may have kicked. I want people to feel that. I want somebody to see that.
Yeah.
But how, what kept me going pretty much, and I have to say, like, full honestly, like my support team and my clients, my support team and my family, even from afar, they have been amazing when it comes to just checking up on me. Like the gifts, like people don't realize, like just gifts, small little gifts. You could send me socks. It reminds me of excitement of, okay, you still are carrying life. So even though the world around me is just like chaos, and if I pay attention to it, it's like depressing because it's like, well, here you are pregnant by yourself. Mm-hmm. Nobody can help you, And that's pretty much it. It, just staying positive and just focusing on the bigger picture, which is you are carrying life. So that's pretty much it.
So do you have any words for other women who are in this situation? Because you're not the only one.
No.
There are a lot of us out there who are excited about bringing life into the world, but then nervous about bringing life into this world.
It is. It's very nerve-wracking. I would say just really try to rationalize the part that you are carrying life, and this too shall pass. And yes, this is not overshining. Find joy within things, whether it be setting up a baby room, setting up little things to just remind you that you are carrying life. And it's beautiful regardless of when it happens, but you're not alone. We're all out there trying to get through this.
Well, you have to let us know when the book comes out.
Yes.
We'll have to bring you back.
Yes, please.
Talk about the book.
Absolutely.
So Danijah Colas, thank you so much. I wish you the speediest of labor and deliveries and the healthiest of babies.
Thank you. Thank you so much.
Thank you for joining us. Take care.
You too.
Now let's bring on Jessika Jackson. She's the creator of Hey Black Mom, which provides information and support and all things moms and moms-to-be need to know. Hey, Jessika, how are you?
Hi, Miss Linda. How are you doing?
Doing okay.
Good. Thank you for having me.
I'm glad you could be here. And you too are home with two little ones. And a little one.
Children who, a 3-year-old and a 10-month-old who need my attention every second of the day. So they're upstairs with Dad now.
Okay. Well, I know the 3-year-old is sitting down with a book. Get up on just everything's fine. Okay.
Yeah. She entertains herself. Even compared to last year, she's able to do some things to entertain herself.
Well, so I want to talk a little bit about Hey Black Mom. It's a space for the voices of Black mothers. They can interact. It's a trusted community because the women in this community know a little something about being Black women in this society. Can you talk about what kinds of conversations they're having and what you're hearing during this pandemic?
Yeah, well, the types of conversations, it's really the COVID-19, being pregnant and during a pandemic, or parenting amid a pandemic even. That's kind of at the forefront right now with some of the conversations I'm seeing. And at first I felt like, I wasn't doing enough to really address what was going on for some of the moms, because this is what, we all know the grim numbers with some of the Black mortality crisis. We know some of the numbers with COVID and all this stuff. So being pregnant during this time, it was just really, really, it's talked about a lot within this community. So I wanted to do something to really showcase those voices and showcase that information, because I felt like that's a way to offer support to these moms dealing with just the unthinkable. The thing about writing or journalism, I'm a former journalist, you just never know who this information is going to touch, who's going to see it, who's going to be impacted by it. And so I felt like it was my responsibility to, make room to showcase these voices and share what's going on with them and how they're feeling. Let me tell you, the women I've talked to, even like the young lady who was just on, they've been overwhelmingly positive when discussing, pregnancy during a pandemic and expecting or just having a baby during the pandemic. And these are really kind of scary times, but I felt like them being armed with the information or other stories before entering that delivery room can be empowering in a way, because the more you know, the more you can be prepared. Maybe you'll ask a few more questions. Maybe you'll pay a closer attention. Maybe you'll have them triple, quadruple check, what's going on, because you have that information. And I think I'm really deliberate about some of the things, my content plans right now, because I want to really give this the attention it needs and the attention it deserves. And so I think sharing stories is just, and show, the mom sharing stories. I think we've kind of, they kind of leaned on that virtual support, because it does come with a certain feeling of isolation, because you can't have anyone around. You can't go to Starbucks and have, your favorite drink because, just to relax. You can't have family and friends over. And so leaning on other people's story, other information, websites for Black moms or organizations for Black moms, I think has been a way to kind of temper that anxiety. At least I hope, that's my hope for it. And so I feel like if you have a platform for Black moms, it's kind of your responsibility to make sure that we have access to this information. Everyone has a different brand, a different style, but if that's a blog from a guest column from an expectant mom talking about her experiences, or a listicle of organizations like you guys who focus on the betterment of Black birth experiences or whatever, it needs to have a place there. And obviously that doesn't take away from the work the organizations are doing to bring this to the light. But I think now more than ever, I'm focusing on really showcasing the information about Black maternal health and showcasing stories about moms going through this as a way to kind of unify us as moms, because we're going through the same, like the singer Sierra, who I think we all know, she had like a live where she said, and she's expecting her third child. She had a live where she said, we're kind of alone together. And that's something that stuck with me, because, I can't imagine how isolating it feels, but that's kind of the purpose of, or that's kind of where my head is at when I'm thinking about what I'm going to showcase on Hey Black Mom.
I mean, it's an uncertain time anyway, but I can't imagine at this point, just adding this fear to the uncertainty. You recently wrote an article about how moms to be are coping with COVID-19, and plans are changed. The things that many moms or moms to be thought they were going to do, they're not going to do. Can you kind of talk about what the new, I won't even call it new normal, but just what the new thing is now? Yeah,
I think I want to say to that, like, that preparedness is going to be key mentally and physically, because like you said, and like we just heard from, I mean, things you are expecting, you can't have them right now. You cannot have a baby shower. It's not a good idea. You shouldn't, because you have to limit your interactions with other people because you're more vulnerable when you're pregnant. You can't do the baby showers. You can't have family over. You have to wear a mask, and I don't know if there's like a mental hurdle you have to get over to think about wearing a mask the first time you meet your baby, but that's just the normal. And I think about the going to these appointments alone, and just again that thing about isolation, having to wear a mask, going to these things alone, making sure that you can't miss any appointments, making sure you're limiting your time. Just all these things you already have to think about. Because when you have a baby, it's kind of like a life-changing experience in itself, and it's a huge thing on its own. And then you add that to, the pandemic, you add that to the revolution and all this other stuff, and it's just like a lot. And so you're having to do it all alone. I was talking to one mom who, although people can't come with her to her well visit, she still has them wait in the car, or some people FaceTime. When I think about physical preparedness, making sure that bag is ready, and making sure that, because as we know, babies come when they want to, making sure that, nothing kind of slips through the cracks as best you can. If you have a child, because you can only have one person in there, making sure childcare arrangements are in place, making sure you have your pediatrician in place. When I had my first daughter, I didn't realize you had to pick a pediatrician. And so when I got to the hospital, this was obviously not during the pandemic, but they're like, okay, who's your pediatrician? So I had to pick from a random book of providers, and that wasn't ideal, but that's what I had to do because I didn't realize that. And so that's some of the physical stuff. And the mental stuff, I think, just making peace with some of those things, like the things you can't have the baby shower, family in the hospital surrounding you when the baby comes, or even afterward when you get home. Right. A lot of these things can't happen. And I think a big thing for these women now, or their partner, their family, they can't hear the heartbeat in real time. And I think that's like for dads, that's a way they connect with the babies, obviously, because they're not carrying it. And I see why that's a big deal, and why a lot of women have mentioned this, that I can't believe he hasn't heard the heartbeat, or I can't believe my mom hasn't heard the heartbeat, or things like that. And so just being mentally prepared for these things, like you said, it's kind of not the new normal, because you don't want to see this remain. There are some things after the pandemic, when we get to the other side, that I wouldn't mind seeing stay. Like if they wash down the ATMs every once in a while, or the gas pumps, that's fine. But you do want to see this restored to some normalcy, where people can celebrate this time in their lives. And so,
and be together.
And together. But we just have to wait a little bit and hopefully get to the other side. But, we're not just celebrating in a traditional sense. So I think preparedness, just mentally making peace with some of those things before you go into the delivery room, because that's going to be a whole another story and a whole big deal. I think that would be what's happening and what they're talking about. But what I will say, if I hadn't already, that these women are just overwhelmingly positive. And I think that's good to spread that kind of message too, and spread those stories around, because they feel like if someone sees it and they have a better day because they said, hey, this mom just had a successful story coming out of birth during a pandemic, maybe I can do this too. Oh, right. These women are going through it, maybe I could, get through the day and get through it too. And so, but at the end of the day, I do hope, in the future, of course, that we get some normalcy restored for this part of it, because it is a big deal to celebrate with people around you if you want to.
So as women are talking on the site, Danijah can have one person with her, which is wonderful. I have read stories where women have given birth with no one. They could have no one in the room. Are you hearing anything? There are not consistent guidelines from hospital to hospital. So are you hearing anything about what women are saying about what hospitals are telling them about whether or not they can have somebody in the room with them?
Yeah, I think with the women I've talked to, that one person rule stands. At least, a couple of a woman I talked to in Michigan and then a woman in Atlanta, those were the rules there, but it's different across the country, wherever you may be. And so once they're in, they can't leave, they can't go out to get food or anything like that. But the women I've talked to who have, half the birth experience during the pandemic, it has been limited to that one person who has to stay with you the whole entire time, who has to wear the mask, when nurses come in and out. And that's a lot, because they're constantly in and out after you first have the baby. So those have been, some of the stories I've seen.
Okay. So I want to talk a little bit about childcare. Mm-hmm. You yourself are in this situation.
Yeah.
There are a lot of women who never knew that they would be considered essential workers, but they are. They've been classified that way, and they have to leave. Often, they've got to go put themselves at risk in front of an unmasked public. I mean, we see that the child care centers are closed. There's, talk about opening them, but many women can't afford in-home care. So are you hearing solutions? Do you have any advice for anything innovative that women can do?
Well,
or that partners can do. Yeah,
I hosted a series where I talked to several moms about how they've been parenting amid a pandemic. And one of those moms, she was a stay-at-home mom, and now her husband's home to help with her. But it's been, having 3 children there who were in school, and now they're home. She's kind of, I think her biggest piece of advice, at least during the time, this was probably about a month ago. And now it's kind of like, will be summer break anyway. But she was like, give yourself a break if you need to, because it's a lot going on. I know we put a lot of pressure on ourselves as moms sometimes to, make sure childcare is fine, to make sure there's a schedule, to make sure you're keeping up in contact with teachers and stuff like that, from what I'm hearing. But, if one day falls through the cracks, or if you have to put on a little more TV, or you have to send the babies for a week with their grandparents, as some people have done, then don't beat yourself up about it, and don't feel guilty about having to, adapt during these unthinkable times, adapt to something that no one saw coming, because, you still have to work. I was talking to a mom the other day and it was really sad, because she didn't want that, but she had to go back to work, and she had to send her daughter to go stay with her mom in Pennsylvania, and she's here in Atlanta, and she was there. She just got back the middle of June. So from March to the middle of June, because the daycare opened back up just for a limited enrollment, she had to be away from her child, and that was really, really hard for her. But she had to go to work because she couldn't lose her job. And so those are, just heartbreaking and sad stories as well. But it's like, what do you do? Right.
Well, but it sounds like you're saying, give yourself some grace.
Give yourself some grace, definitely, because, it's even I'm in a different situation because I could work from home and my kids are here with me, but it's hard sometimes to, we just put a lot of pressure on ourselves, I think, especially, during this time. This is the time you shouldn't be doing that, because everyone is kind of dealing with just unthinkable circumstances, and this thing has affected different families in so many different ways.
So I think this is a time to be not only gentle with yourself, but with others. You have children, you're taking care of them. There's no wrong move. You're taking care of each other.
Yeah, exactly. Worried about, I was so worried about, what is she going to be, my oldest, what is she going to be missing? She's, has these classes. Is she going to be, behind or something like that? But after a couple of weeks, I'm like, I don't even have time to think about that, because every step of the way, they need me there for something or other. So it's just no relief. So it's no time to really.
And she'll be fine. I mean,
yeah, and she's been fine.
The thing I want moms to know is their children will be educated. It may look a little different, but
yeah,
it will happen.
I think I saw a mom say that, don't worry so much about that part. You want to worry about their well-being, their wellness, their health, their mental wellness during this time too. So focusing more on making sure they're still happy and safe as best you can.
Yeah. Well, Jessika Jackson, creator of Hey Black Mom, thank you for all you're doing for moms and moms to be, and thank you, and be safe.
Thank you, and thanks for having me and for all the work you've done and continue to do.
Thank you.
Okay.
Now let's turn to Dr. Sharon Thompson, an obstetrician in Phoenix, Arizona.
Hi,
Dr. Thompson, how are you?
Good.
I'm just sort of laughing because of the state of Arizona at this moment.
Whoa, yeah.
As I was sort of making notes, the first thought I had was, you're on the front lines in the heart of darkness in Arizona.
And I laugh because that sounds way too accurate.
Yeah,
Way too accurate.
So your work with Black women of color and women of color are expecting, probably a little more than anxious about giving birth right now in Arizona and in Phoenix. So I want you to tell us a bit about your practice. But first, I just noticed something in your bio where you said that you have discovered Dance Revolution. So I don't know if you're any good at it.
No, I am terrible. In fact, I've been instructed by my nieces and nephews never to dance.
I see.
But I do it anyway. Just don't do it in front of them.
If it brings you joy, then,
And, in these times, you have to look for what brings you joy. It's so important to remember that. Joy is still available.
So tell us about your practice and what you're seeing now.
So my practice does both obstetrics, taking care of pregnant women, and gynecology. And of course, I think everyone in the country is affected by this, just to varying degrees. We're in the midst of rising cases in Arizona. And so I spend a lot of my time, retooling my entire office process and how we do things to make sure that we keep patients safe and our staff safe as well. So I spent a whole lot of time doing that. We're still in the midst of some changes even this week, but also trying to educate patients, both pregnant and not, about being. I don't like my patients to be scared. I feel like part of my job is to help them be realistic about what risks are, but also to not live in this state of fear. So I spend a lot of time talking to them about what a virus is, how they spread, the things that we know. Even though this virus itself is completely new, there's things that we know about how to prevent virus transmission. There are things that we know that are safer activities, and there are things that we know that are riskier activities. So I review those with them. I talk to them about the kind of environments that they're in, that their families are in, and what they can do in those circumstances to reduce their risk. So I spend a lot of time having those sorts of conversations so that people are appropriately cautious, but not scared to death of living in the world, because you have to live in the world.
Right. Are the hospitals in Phoenix, are there consistent guidelines, and are they allowing delivering moms to have someone in the room with them?
So like was mentioned in your other interviews, our hospitals are limited to one visitor, and that visitor has to stay the entire time. Now, what I say to patients, though, is that every year we have flu season. And during flu season, we have visitor restrictions as well. They're not quite this strict, but almost. Because interestingly about this pandemic, what we're seeing, and I'm sure you'll have more questions about this, but what we're seeing is that pregnant women are not more likely to get COVID than people who are not pregnant. And this is very different from the flu, or than pandemics in the past, H1N1, which is our most recent one. Both of those infections, pregnant women are more likely to get. So whenever flu season comes every year, we're very restrictive in terms of, labor and delivery, in terms of visitors, and our instructions to pregnant women. COVID added to those restrictions a little bit because it's new and we're sort of figuring out, how this is going to go. But we always have restrictions for pregnant women every year during flu season. This is in addition to that.
So let's stay on that topic, because I did have a question. So what we've heard is pregnant women are not more likely to become infected, but
right?
They are more likely to have severe disease. Can you talk about why that might be?
It's actually even a little bit more subtle than that. And for folks who are not obstetricians, they may not remember the previous pandemic like obstetricians did. And the reason for that is that with the previous pandemic, pregnant women were more likely to get it, and they were far more likely to die from it. So H1N1, the mortality rate for pregnant women was 19%. Wow. 19. Wow. Yeah. So during that pandemic, obstetricians every day we went to work and heard about another woman who got it, another woman who died. So this pandemic, we're sort of like, ooh, we're not seeing that, and we're so grateful. But what we are seeing is that pregnant women seem to be a little bit more likely to wind up maybe on a respirator, to wind up in the ICU, but funnily enough, not to die.
Even when they're
even when they have more severe disease, their mortality rate is not higher, which is, and I have to say all this with a grain of salt, because this is a new virus and we're learning. The numbers that we have right now, the data that we have, is based on tiny numbers, because what people are doing, scientists are doing what they do, thank goodness. And as we learn more, as we get more data, they are processing that data quickly so they can feed us information. So, and that's where we're getting the data we have. Now, a year from now, we may churn these numbers and find something else, right? Find some other conclusions. But for right now, it looks like pregnant women are not more likely to get it. They're slightly more likely to get severely ill, but their mortality rates are not higher. So,
we'll take it.
I don't want you to get it.
Right.
I don't want you to get it, but I don't want you to live in fear of getting this virus. I want you to take precautions. Like I said, we review the woman's environment, we review the environment of everyone in her household, and we talk about how we can minimize the risk for everybody. But I don't want them to feel that their whole pregnancy is under a blight of COVID, because I say to pregnant women all the time, this is the only pregnancy with this baby you will ever have, and I want you to enjoy it. No matter what's happening, I want you to find joy is available, and I want you to find it.
So one of the things I know pregnant people are concerned about is transmission to the fetus. So yesterday there was a report on a very small study out of Italy.
Right.
That suggests there could be transmission to the fetus, could be transmission to the baby through breast milk. I talked about umbilical cord, blood. The study is small. The folks at NIH said, well, we're not really sure. Have you heard anything at all about that?
I'm reading what you're reading. If for this pandemic, we're all contemporaneous experts because we're all getting the information at the same time. And what I was interested in terms of that study, I read the same one, is that they reported that virus was found in the umbilical cord blood, meaning virus gets to the baby. But that's not so unusual, right? Because viral particles are small, and we know, and also they reported antibodies were in these same places. We know that moms share their antibodies with fetuses. So I expect the antibodies to be there. What wasn't clear to me was there enough virus to cause infection?
Yeah.
Right. So just because there's virus crossing the placenta, maybe mom's antibodies are enough to combat that virus. And so baby is born healthy and never has any manifestations. So that answer is still to come. Right. Yeah. But we're getting more and more data right now. What we're advising moms is that if a mom has COVID disease at the time of her delivery, we want her to wear a mask around her baby. And we want her to breastfeed, because we know that those antibodies are the only immunity that that baby will get.
Yep.
And as mom builds antibodies to this virus and others, that those antibodies will pass the baby. So we definitely want her to breastfeed. I say to moms, even if you would never breastfeed another baby, breastfeed this one, right? That baby.
Really interesting. Yeah. CDC's guidelines said,
Oh my God.
right.
You know, they build their own immune systems over the next 4 months, especially as we approach flu season and other adenoviruses, et cetera. We don't want to leave that baby naked and exposed to those, you know, for fear of COVID. So, and also the data that we're seeing on newborns and COVID, it looks reassuring. So even when we see babies who are born positive, those babies, one, can clear very quickly. And we don't quite understand that yet. And we're not seeing severe disease and death in that newborn period in large numbers. So we're a little bit guardedly optimistic about babies and COVID in terms of transmission from their moms.
No, that's good news.
Yeah.
Your mayor, Mayor Gallego, has been in the news recently, taking issue with the federal government on testing. She, in a news report, showed long lines, 5 to 7 hours.
Too long.
Lines.
Yeah.
You know, and it's hot in Phoenix, it's hot in Arizona. So is there a plan to improve testing? I'm imagining the doctors have gotten together and you're advising, you know, on the government on how to do this, and they're listening.
So our national COVID response has been, let's say, less than ideal. One key component of any new or any disease outbreak is a disease identification. And in this case, we have a test, so we can use the test to identify. And there are many, many obstacles. I won't go into details of why tests aren't available, why they take so long. There are many different things that make a lab test available to the public. And let's just say Mayor Gallego is expressing her frustration that those sort of pathways are not being smoothed by powers that be. And I think that I don't think I'm telling new news when I say that our federal response has been disappointing. These are things that the federal government and state governors can help with, is ramping up testing, making sure. So you were talking earlier to the other guests about the loneliness of being pregnant in this pandemic. Testing can help with that, right? Imagine if you could test your family members or your support network that's near you. You all know you're negative. You all make an agreement about the kinds of precautions you're going to take. And now you can socialize with one another. It creates a network for you that you might not otherwise have. But if testing isn't available, you can't do that. So testing would make lots of things easier. Governments can also contact tracing to help keep sick individuals so that they will have excellent instructions about staying home, what they can and cannot do, because they're the ones who are infectious. We really need to identify folks who are positive so we can keep them out of the general circulation and reduce spread. Governments can do that. I can't do that. I can't trace, individuals. Governments can give us great guidelines. It really worries me when I watch some of the president's news conferences recently, where he's saying, I'm going to tell the CDC, we don't want guidelines that are too strict. Well, I want guidelines that are appropriate.
Right.
Strict or not, if that's what we need, that's what we need. And we will, revise our processes, revise our practices to fit with those guidelines to help us live as healthy as possible within those strictures. But I don't want the guidelines watered down. Thank you very much. I want them as strict as the scientists say we need them. And then we will retool our habits around those guidelines. So those are the things that I think Mayor Gallego is trying to express, like, can I please get you to help me with this? And I agree with her. I'm with her on that.
Well, I am too. And this is, as we have said many times, not rocket science. We do know what to do. So,
and as a nation, we've done it before.
We have.
Leadership matters. Leadership matters.
You have not said truer words ever in your life. Dr. Sharon Thompson, thank you very much. Thank you for taking care of women and bringing babies into this world.
Thank you so much for having me and for tackling this great topic.
Thank you. Be safe. Be well.
You too. Thanks so much.
Thanks. So I want to thank again Danijah Colas, Jessika Jackson and Dr. Sharon Thompson. And thank you for joining us today. Next week, we'll have another episode at 4 p.m., so please join us. And if you haven't done so already, please take a moment to visit our website, coronavirus.bwhi.org, which we've developed to provide COVID-19 information and resources just for you. According to a University of Pennsylvania study, 1 in 10 Black and Hispanic pregnant women have tested positive for COVID-19, as compared with 1 in 50 pregnant white women. So the good news is, as you heard from Dr. Thompson, they're not more likely to die because they're pregnant. So we can have some confidence in these figures because pregnant people are more likely to be tested simply because they're going to see their providers more often. So while people who are expecting may not be at greater risk for infection, what we do know is that for Black moms, they are at a slightly greater risk for severe disease, and they are 3 times more likely to die. We know the maternal mortality rates as compared with white women. So we get a picture of people to whom special attention really ought to be paid. This is against the backdrop of soaring numbers of infections in almost every state, as too many refuse to wear masks and stay apart, as testing is less available now than it was 30 days ago, and it takes longer to get results now. We're going backwards. This despite the fact that we've had over 4 months to learn how to protect communities from COVID-19. As you just heard, we can test, we can trace, we can isolate. And we have ample evidence that wearing masks protects those around you and may even protect you from others. We're back where we started. We have an administration and some governors and mayors who have dammed the torpedoes and rushed full steam ahead into opening businesses and sending children into classrooms without assurances of testing, supplying personal protective equipment, or a plan for mitigating the inevitable spikes in infections. As a kid, I enjoyed roller coasters. There wasn't one that was too high or too fast or too scary for me to ride. I'd get on. When the ride ended, I'd be right back in line and do it all over again. If the projections for the numbers of people in this country who will contract COVID-19 are anywhere near accurate, we will be on a roller coaster of opening businesses and schools, then closing them when infections rise, and then opening them again until a vaccine is widely available or until we reach herd immunity, at best 2 years from now. Roller coasters are for our amusement. The public's health is serious business. We have enough data now to make informed decisions on reducing COVID-19 infections. We know what works. We can stop talking about how bad things are and do what we know to do. End this ride. Thank you, and we'll see you next week.